This episode brought to you by Reconcile, Nationwide, PetMate,
and Doggy Hush. Hush the noise.
The Experts with Kristen Levine. On today's show, Victoria Stilwell, Dr. Andy Rourke, Dr. Lisa Radasta, Alex Sussa.
Hello, pet lovers! I'm Kristen Levine, and welcome to a very special edition of The Experts. June is Pet Anxiety Awareness Month, and we are focusing on our canine friends for this show. This is a time dedicated to understanding and addressing the fear, anxiety, and stress that our pets may be experiencing. Research indicates that up to 99% of dogs exhibit at least one sign of fear, stress, or anxiety in response to common stimuli or environments. From noise phobia to separation anxiety, our pets face challenges that can impact their well-being, and ours too. Now, today we're joined by a panel of amazing experts to discuss various aspects of pet anxiety and to provide guidance on how to help our furry friends lead calmer, happier lives. So what do you say we meet our panel? Welcome, panel.
Thank you. Thank you.
So first up, we are joined by Dr. Lisa Radasta, a board-certified veterinary behaviorist and owner of Florida Veterinary Behavior Service. With over 2 decades of experience, she specializes in helping pets with behavioral challenges. Welcome, Dr. Radasta.
Thank you.
Joining us next is Dr. Andy Rourke, a practicing veterinarian, international speaker, author, and media personality. He's the founder of the Uncharted Veterinary Conference and is a passionate advocate for veterinary professionals. All right, and next up is Alex Sussa, a certified dog trainer and behavior consultant known for her work with both family pets and complex behavior cases. Through her company, Peach on a Leash, she helps pets and their people live in better harmony. Welcome, Alex.
Thank you.
And her dog, Rosie. Can't
Yes,
forget Rosie. And we have Victoria Stilwell, a renowned dog trainer and behavior expert known for her work on It's Me or the Dog. And I learned that you actually created that show. You weren't just on it.
Oh, no. I created it. Yeah.
And you've also produced many other shows.
Yes.
Victoria advocates for positive reinforcement training methods that build trust between pets and their owners. So welcome and thank you all for being here.
Thanks for having us.
Yeah. This is a special show because it's Pet Anxiety Awareness Month in June. And this is an event that I started many years ago. And so I'm really honored that DOGTV and the Unleashed channel and the experts embraced it and invited all of you here to help us. So what is a board certified veterinary behaviorist?
Right. So a board certified veterinary behaviorist is a veterinary psychiatrist. So you go to veterinary school, you do the 4 years, you get your license, and then you do a 1-year internship. And then you do 3 to 5 years of residency, you pass the boards, you publish the things, you do the things. And then you're a board certified veterinary behaviorist. Yeah. So we treat the most serious of behavior problems, and we do that by partnering with the pet parent, with a primary care veterinarian, and with dog training professionals. So we put the pet at the center and we kind of pull that team together.
So we've got a very holistic team approach here to answer your questions today. Let's listen to our first viewer question. This one comes from Mark in San Diego.
Hey there, panel. Mark and Murray coming to you from San Diego. Just a quick question for you guys. My dog seems to have some anxiety, especially when people come over. Is there some kind of natural remedy that he can use or that I can use that might calm his anxiety and kind of control my guilt? Any help with this situation would be greatly appreciated. Thanks a lot, guys.
All right, so Dr. Rourke, would you like to kick it off?
Well, yeah,
here?
I love the fact that he just called out up front. We want to calm his anxiety and my anxiety. And I feel like that's such a big part of it is the spiral of you have an anxious pet, and that causes the pet owner to get frustrated because we're human beings. And you have this behavior, you have a big party, and then all of a sudden your dog is jumping up on people, or they're barking, or they're exhibiting, they growl at someone, and that becomes a focal thing. And you can't help as a pet owner but feel ashamed or feel scared or feel worried. And so there's this big interplay between the emotions of the owner and the pet. And so that sort of spiral upwards of anxiety from the pet impacting the owner. Like owners having a less than ideal relationship where they're angry or frustrated at their pet when nobody wants that.
I would say it's probably one of the most common issues we see are dogs that are uncomfortable with new people coming in. And to kind of answer his question, there isn't a quick fix. There really isn't one product that we can say, oh yeah, we'll just do that and we're gonna fix it. We have to address what is the underlying cause of the behavior. So first my question would be, what are the behaviors you're seeing? Is it barking? Is it growling? Is it snapping? Is it running away, hiding? There's a lot of ways that this can play out, but first we want to see what does it look like, but then also what is the underlying cause of it. And so often the dog's just not confident, not comfortable with new people. So what we have to do is help the dog feel better about that. So we're going to use desensitization, counter conditioning to help them feel better.
First of all, there are supplements that will help this pet.
Yes.
I think that has to be said. Quick fix or not quick fix aside, are there supplements that can help this pet? Yes. However, the supplement market is largely unregulated. People are buying supplements from their grocery store made by, Dr. Jones, if that's even a real doctor, in his garage, and they're putting that in their pet's body. And you just have to look at a couple of research studies to see how many of these supplements for humans, much less for animals, do not contain what is on the label. And they also contain things like lead. This is an actual study done of CBD products. Some products contain lead, right? So these can be dangerous. So you're going to go to your vet, you're going to ask for brand name. Number two, what I would say to this pet parent is wants versus needs, baby. It's your want for him to meet your friends. It's probably not his need. And just like we have expectations of our partners and our kids, let's step back and go, it's your want. So if you want something the dog doesn't need to be your want, that is money, it's working with a dog training professional, it's your time, because you better follow up and do your homework. It is not a supplement, but probably a drug. And then pet parents look at me and go, well, what's the alternative? Put the dog in a room with a food toy stuffed with canned food and enjoy your martinis with your friends. So everything doesn't have to be the gold standard fix. It can be acceptance and love. And that's where I would like people to start.
I really like that, wants versus needs. And Victoria, do you see that where people have wants that they want for their dogs, but their dog doesn't really need to do?
Why do people get a dog? They get it for companionship. They want it to be social. A lot of dogs aren't social. A lot of dogs have different social needs, different social preferences. So the first question I ask before anything is, does the dog feel safe? Right? There's one thing about being safe, okay? You put it behind a baby gate with an enrichment toy. I think that's really important. But does the dog feel safe? And so that's where I start. That's my starting point. And then I'm going to give the dog tools and skills to work with their person, with their guardian, so that they can both approach the problem together, because it's a team thing. It's not just the dog's problem, right? And I think a lot of people say, oh, this is the dog is the problem. It's not.
To fix the dog. I feel like there's a lot of the expectation.
Exactly.
That dog doesn't need to be fixed, potentially.
No.
Potentially, that dog just needs to be heard.
Exactly.
Right? And loving an animal is not the same as hearing what the animal needs. We all have this. If we just ask people to just step back and take a breath. Do you have a partner, a child or a partner, who engages in something that they like and you don't, but they want you to engage in it? My husband is a sports fanatic, and when hockey is on, we actually make him go to the garage. We put a TV, we air condition the garage and put a TV, because he's yelling and cursing, my gentle, sweet husband, right? I don't want to be a part of that. Yes. And so my need is to have a peaceful home, right? He wants me to sit with him while he yells. No, we wouldn't be married. So if the dog doesn't want to be with your friends, he doesn't like your friends, who cares? Let the dog be the dog and be happy, as long as they feel safe. Right.
Great point. Well, why don't we go to our next question this one is coming to us from Jackie in York, Pennsylvania.
Hi, my name's Jackie. This is Gertie. And Gertie gets scared when thunderstorms come around. She runs into the bathroom. I'm curious why the bathroom. And also, if there's anything I can do to help relieve some of that anxiety. Thanks.
Okay. Noise phobia.
Yeah.
Super common, right? How common is this?
It is really common, and especially if you live in the southern states or the Midwest, it's even more, where dogs are having to listen to thunderstorms a lot. And interesting, she said that her dog runs into the bathroom, and I know, Lisa, you'll probably be able to speak better about this as well, because from a medical perspective and from a behavior perspective, we see that a lot of dogs go into the bathroom, and sometimes that's because there's just no windows there, and therefore that it muffles the sound. But there's been studies done, and I don't know how good the studies have been, that have shown that actually rugs, carpets might be giving a little static electric shocks to dogs, so that they run into the bathroom where it's usually a tiled floor. They can maybe ground themselves. A lot of them go behind the basin or the wash basin and ground themselves next to a pipe. But also, I just think it's because it's a smaller room and it's more confined. So in fact, your dog is probably going there because it is feeling a little bit safer.
Sure.
I'd say that, yeah.
Yeah. So again, I guess it's the same message. Listen to the dog. The dog is saying, I feel safe here.
Yeah.
We can try to force Gertie to do something else. We can, but it's going to be forcing someone who's panicked.
Yeah.
So if she prefers the bathroom, I'm going to go with the flow. I'm going to make the bathroom a queen's palace. It's going to be everything that she wants. I'm going to have, maybe I might use brown noise, or I sleep with airplane noise from an app that I have, or maybe she likes classical music, so I'm going to drown out the ambient sound. Maybe she likes food toys. I'm going to put food toys down. So I'm going to make it whatever she wants, and I'm going to help her. So if I know a storm is coming based on the 5 weather apps, and people with noise phobic animals know, you got 5 apps. It's not one app. As you go to predict that storm, you're getting Gertie in. You're not shutting her in. You're enticing her to go in. You're trying to get her to stay there of her own accord, because that door is going to be open. She can leave when she likes. And then, of course, there's tons of medicines and things that we can also use, but the most important thing to start with is that sanctuary space. It's a big deal.
And let's just stop it right there, because our next 2 questions are quite similar. So let's roll those next 2 questions, and then we'll jump back into the conversation.
Okay.
Hi, experts. My dog Rocky, in the past year, has become really sensitive to sounds. Anytime any sound is being made, he barks really loudly, and he seems really confused as to where the sound's coming from. I was just wondering, is there anything I could do to help ease his noise sensitivity? Thanks.
My dog completely panics whenever there are fireworks or thunderstorms. She shakes, hides, and won't eat for hours. What can I do to help her feel safe during loud events? Thanks, experts.
So yeah, we wanted to run those questions together because they're all noise phobia related questions. And with it being June and the July 4th holiday coming up, we wanted to give pet parents the tools that they need and the advice that they need to prepare for the noisy holiday. So Dr. Rourke.
I want to jump in on Jenny on the second one that we saw there when she was talking about, I think Rocky, I think. This barking loudly whenever there's sounds. One of the things that's easy to gloss over is, especially in this case, I would have this dog looked at just for a regular medical examination. Like, this could be a dog that's losing his sight, and then that's why when he's hearing these sounds, he's reacting really strongly. And that's true for all of them, but especially for that dog specifically, just in that seeing him sort of on camera.
And it's such a sudden, anytime we see a sudden change in behavior, we're always like, we need to get to the vet. We need to get the vet involved. We need to get a vet behaviorist involved if we're seeing a sudden change in behavior.
And sometimes you hear that the dogs become more sensitive to sound when they are in pain as well.
There's a lot of things like that could be going on with that dog. So I would say, let's slow down here for a second. I want to jump back to a general physical examination on that, but honestly, probably all of them as well. And I feel like, I'm curious if you guys agree, the last case is almost an advanced version of the first case that we saw, going to the bathroom. Now we've moved on to a level of fear where we're barking, reacting. I don't know if you sort of see that as a higher level, or if you see those as totally sort of different things?
So it's going to depend on that dog's coping tools. So not surprising to anyone who knows me, when I'm nervous, I talk more, right? But sometimes when people are nervous, they talk less. So we can't say that a barking dog is more stressed than a dog who is huddled in the corner, right? So we can't say that. We can call things more generalized. I'm guessing that at some point, Rocky's going to refuse to walk outside. That is coming. He's going to start having accidents in the house because he's so afraid of what's going on outside. But I want to really lend a lot of credence to what Andy just said. So number one, all of these dogs could be sick. 50% of dogs who get to me, so they have vets like Andy, they get to referral system, 50% are sick. 5-0, that is a massive number. And not just when it's sudden. Every dog can be sick. And anytime a client says, my dog doesn't eat for hours after a storm, or they leave the house or whatever happens, I'm already going, your dog has GI disease, gastrointestinal disease. If you don't eat during an event, I get it, because dogs aren't stress eaters like we are. They don't sit down in a tub of ice cream when they're worried. But if your dog doesn't eat for hours later or for days, that dog is sick. You have got to go to your veterinarian. And sometimes you're going to have to go to your vet and say, I want these tests. Because vets don't know everything. Sometimes they need some suggestions for them.
Sure. And I think when we have a dog that's encountering a really stressful event, those cortisol levels are going to take a really long time to go down back to kind of normal levels. That's something that we've seen in the research, is that when a dog experiences especially multiple stressful events. So if we have a dog like this that is constantly in a state of stress, it's going to be really hard to get back to kind of a normal place without the help of one of these guys.
Right. Because then you have chronic stress. That's what chronic stress is, when the dog doesn't have time to come down and then it always stays at this level. So then maybe you've got the storm one day and then the next couple of days, that dog is still in a state of chronic stress. And if those stresses keep coming, then chronic stress causes disease. So that's something that we really have to work on. That's something that we have to go to our vets with, or our vet behaviorist, and say, look, a client has come to us that we really think that this is also needs some medical intervention as well.
It can actually cause behavioral issues as well. So what we see sometimes, we call them distant antecedents. So it's basically like something that happened unrelated to a big event. So let's say the dog bites somebody. I'm like, that's so strange. Why would this happen? It seems so out of context. But the night before, there was a storm and the dog was panicking from the storm. The next day, somebody comes over that the dog's unfamiliar with. The dog is already still stressed and experiencing that stress from the first event that is potentially affecting what happens the next day. So we see it a lot where these things that seem totally unrelated can cause behavioral issues that otherwise might just seem completely unusual for that particular dog.
That's so interesting. What is there a typical age that we see that onset in a dog?
So we can see dogs present with noise phobia at any age. The problem is that a little less than 50% of pet parents don't recognize it.
Yeah.
That's the problem. So they can't present to us early because they don't know what they're seeing, right? They don't know if that it is a problem. And then most of those pet parents don't talk to us. And they don't talk to their dog training professional. They talk to their friends, they talk to their mom, right? And so they go on years and years. And what we see is that dogs at around 4, 5, 6 years are presenting to us for storm phobia, but it's been going on since the beginning, right? It's been going on since a year of age or 6 months of age. When we talk about medicine, I want to encourage people to think about pharmaceuticals. Not every dog or cat with a behavior problem needs a medicine or a supplement. Right off the bat, I'll put that out there. But for the ones that do, it can be a miracle because, again, my approach is, you created this world for your dog. Your dog's not fit to live in New York City. That is not where your dog should live. He's afraid of trucks. He can't even go to the bathroom, my God, for God's sake. So then when you think about it that way, not only did he not choose it, but he can't choose to get out of it. Think about that for a second. If you had no control over the outcome and you were panicked every day, that dog needs 2 drugs. That dog needs medicine. People are worried about, is it safe? So we have FDA-approved medicines now they're FDA-approved for separation anxiety. However, we use them as vets, and you guys have seen them with your clients, your patients. We use them for lots of different things. That's called off-label use. One is called Reconcile. That's Prozac, right? Approved for use in dogs. The other one's Clomicalm. And we choose Reconcile exclusively over the generic. And I think this is an important message that people need to hear. And I've said it so many times before. You've heard me say it, right? Because there's a difference between the quality control, the amount of the drug that is in that tablet and has to be in the tablet, the fillers, the inactive ingredients. It's brutally important to ask for the generic. And luckily, yay, the cost has come down. Ask for the brand name.
For the brand,
the brand name. The cost has come down so much. It's not much of a difference, especially with Reconcile, between fluoxetine and Reconcile. And so when a patient comes to me and a client says, we have heard this, clients have said to me, this is going to shock people. If you don't fix this in a month, I'm going to euthanize this dog. I know you've heard.
You get that too.
All the time.
And so when they say that, am I going to hold back and use the generic and be, no. I'm going to use the golden bullet. I'm going to use what I have in my arsenal where I know it's going to do what I expect it to do. And also, if I see a side effect, I know that that's a side effect of this drug and I can stop the drug, right? People want to know, how long will my pet be on it? To infinity, if that's what you want.
What's a quality of life
issue? That's what you want. That's right. It's up to you.
Right.
It's up to you. Will it shorten my dog's life? Absolutely not. We've got 30 years of information on fluoxetine, which happens to be the generic of Reconcile. So
No, I'm so glad you're saying this because it's still so stigmatized to use it. To your point, as you were saying, to use medication for your pet. But we can relieve so much of that anxiety and stress that they're going through. Can you think about it from a human point of view, how debilitating it is when you're so anxious or you're so stressed out or you're depressed? I mean, we doctors are prescribing these kind of medications for people all the time that are helping them. Why can't we do the same for
It's
our
not
pets?
a cop-out.
No.
It's
Not at all.
You know, therapists talk about necessary suffering and unnecessary suffering. Making your pet go without something that will help them and not hurt them is causing them to unnecessarily suffer.
And I think that goes back to it not being last resort also, or we're intervening early enough and we're doing it in conjunction with behavior modification. So we normally like to get meds on board. When we start training, we hit a plateau a lot of times really quickly. We're like, we're not getting anywhere. And this dog's quality of life is so poor. They're just so uncomfortable in their own skin. So if we can intervene early on the medication side in conjunction with a vet that knows what to prescribe and how to do it, the change can be so life-changing, not just for the dog, but for the humans as well.
And
like,
I probably wish they had talked about it so much earlier at that point.
The secret failure is not that the pet can't change. It is not. It is that the pet owner has run out of patience.
Yes,
And again, which is a lot of times people will get motivated, they want to make a change, and they will go all in. But they don't have the tools that they need. They haven't really gotten the best advice or whatever. And so they're really working hard and they're trying hard, but they're not in a place to be effective. And then the family, after a while, the family gets frustrated and we all get tired of pushing and doing our best and making concessions and changing. And now let's talk to the vet. Now let's get a trainer. And you say, if you had taken the wonderful energy and commitment you had at the very beginning and come to us then, we could have guided you and you could have used it and been so much more effective. But I want to jump back really quick with the pharmaceuticals when you talk about people. Think about a human being with social anxiety.
Yeah.
One of the things that you'll see in treatment of people with social anxiety is medication to help lower their anxiety, and then they practice their social skills, they build the networks, they build confidence in themselves, and through use of that medication, we get the skills that we need. The same thing with people who are depressed is they'll go on antidepressant, but then they learn the life skills, the coping skills, they build the relationships and the networks that sort of help them to go forward. And we may or may not continue on the medication, but it's through that pathway that we ultimately build the coping mechanisms we need to use, whether or not we continue the medication.
I want to make sure we get to some more viewer questions, but also because we're coming up to the July 4th holiday, a little toward the end of the show, we'll talk more about creating that perfect, comfortable Zen zone for our dogs that have noise phobia when the fireworks start going off, which unfortunately gets earlier and earlier every year. Okay, so, and this is such a great conversation, by the way. I hated to stop you, but let's get some more questions in here. This one's from Ryan in Cleveland.
Hi, experts. Our dog really struggles with anxiety when we bring her to her doggy daycare boarding facility. Do you have any advice on how we can handle that? Thank you.
Oh, I like this question.
I'd like to start with don't go to daycare.
Personal story. I used to take Chili to doggy daycare. He loved it. Well, that particular doggy daycare closed up. So I took him to a new one thinking he loves doggy daycare. They called me within 45 minutes and said, I don't think Chili really wants to be here. So I went and I picked him up. So I was so thankful that they did that.
Right, that's good of them to do that. I think when the reason why we were like, ugh, is because a lot of people, when we experts, when we think about doggy daycare, you have to, as your story illustrates, find the right one. And you might have a dog that's actually not great for daycare.
And that's okay.
Right, and is not great to be boarded. And so then you have to find other ways. Could you have friends, family members, people coming to your home? I mean, it's a real problem. There are great daycares out there, but I think daycare in itself is a whole show on how to do it correctly. And you can't have your dog playing for 6-7 hours a day. That is going to exacerbate their stress a lot. There has to be rest times during the day if you're going to take your dog to daycare, but also boarding facilities. It's really hard to get it right. And then, don't get me started on this, and I will be quiet after this, is when you send your dog away for board and train. Now, there are some great board and trains. Here, Reach and Leash do great board and trains, but there are a lot of companies where you send your dog away to board and train. Whoa. It's you don't know what they're doing to your dog. You have to be really careful.
What happens
So this whole industry, daycare, boarding industry, board and train. You have to do your research. That's the headline.
I think back to my children, and when my children were really young, I had these wild ideas of maybe they'll be professional athletes. So my kids don't care about sports; they don't want anything to do with that. Right. And if that was the metric by which I was like, well, I have good kids or not, that would be terrible. Yeah. They go, look. My daughter is not remotely interested in sports. She's interested in dance and theater. And I'm like, well, let's get excited about dance and theater.
Exactly. So you're catering to, but I have to say kudos to this gentleman because he's trying, right? Yes. I mean, does he work all day? He probably does. Yes. So he's doing the best for his dog by taking his dog to daycare. So kudos to people who are doing that. It's just, again, it has to be the right fit.
Yeah. So does your dog like playing with other dogs? When your dog gets the opportunity to play with the dog in your neighborhood or your friend brings their dog over, do they like that? So, okay, check that box. They do. Number 2, does your dog like being in big groups of rowdy dogs? Because a lot of daycares are like frat houses. Yeah. And I don't want to go there, right? And so, of course, it makes dogs feel nervous. Sure. Does your dog feel really comfortable in a group of dogs? If you check that box, then that might be right. Then we have to go to the third box, which is visiting all the daycares in my area, watching the dogs play, watching how they're handled when the play is too rough, because it only takes one innocent person to reach in and grab a collar and hold it too tightly for that dog now to be head shy. Yeah. And pet parents don't know because the person who did it, frankly, was innocent. But I think we have to take one step back here because I want to make sure that we four are not being interpreted as pet parent shaming. Yes. Right. Here's the thing. Yeah. Here's the thing. If you want to give a medicine and not do behavior modification, it's okay. If you want to try behavior modification with no medicine, it's okay. If you want to do none of that and put your dog in a room when you have visitors over, it's okay. If you don't want to bring your dog to daycare, most spayed and neutered dogs sleep all day, and you want your dog to sleep on your couch in your house, it's okay. Right. It's okay. Right. Your dog doesn't have to be anything different than what he or she is, as long as they're happy and they feel safe.
Yeah. And we know that, we dealt with a lot of clients, right? We're there to support them. Yeah. This is not just because we're dog-centric people or pet-centric people that we're just going to focus on the pets. It's a team. So the way that a client feels is really important to me. Yes. I really am going to provide support for them too.
And they feel relieved a lot of the time when I tell them, like, your dog does not need to play all day with other dogs.
Like you gave permission.
They feel so guilty because they work all day and they're like, well, I thought I was just doing something nice for him that he loves it. I'm like, I think your dog would love to stay home all day and sleep on the couch and he's going to be way happier doing that. It's okay.
Or even, I love the idea of getting creative too, is to say, we say, well, this dog might not be the best for daycare. What is important to you about daycare?
Like, I love asking those questions. What's important to you?
I ask that question a lot. If you ever come see me, I say, well, what's important to you about this thing you're doing with your pet? Yeah. And that's really, is it an exercise need? Is it a socialization need? And then what are the other ways that we could achieve this? I'm worried about him being lonely. Is there someone who he knows who could stop by the house, and see him there? And again, we've got dog walkers, we have things like that.
Is there DOGTV?
You've got DOGTV. You just put that on.
That's great.
Nice.
Yeah. So what are the alternatives? I don't like to shut people down and go, no, that's dumb, we're done. No, it's like that.
Exactly.
But let's think about other ways that we could meet the wants of the pet, because that's really what we're talking about.
Yeah. Well, we could definitely do a whole show on boarding and daycare, so maybe we'll do that next time. Let's take another question from Elaine and Lily in Oregon.
Hi, experts. My dog Lily has separation anxiety. When I leave for a short period of time, should I try to just sneak out the door and maybe she doesn't even know that I've gone? Or should I go through the whole thing of letting her know I'm leaving, I'll be home soon? And what can I do to ease her anxiety? Thank you, experts.
Another really common challenge with dogs is I've read that this is more common than noise phobia. Is that what
they're about the same? About 50%, depends on what study you look at. Yeah. About 50% of American dogs are afflicted by noise phobia. Some studies for separation-related disorders are 25, some 50. It just depends, because these are survey studies, right? Yeah. So you're asking people, and you're also asking them based on what they recognize, and there's probably a fair number of dogs who are depressed at home that people don't even know that they are upset because they're not destroying things. But I do want to answer this question and give you a short and sweet answer. Don't sneak out. The latest research shows us what we should have known via common sense, but we just didn't, is that we want to make sure that your dog knows what you're doing, and the structure of you departing for work looks like A. When you're going to garden, it looks like B. When you're staying home, it looks like C. When you're getting them out, it looks like D, right? And so anxious dogs become more anxious when you act crazy and you act inconsistent and they suddenly realize you're not gone. So it's much better for them to have a routine based on the most current research.
Yeah.
That a lot of times what people think is separation anxiety may not be. We often see where that's what people will describe it as, and then it isn't. It might be that the dog is briefly distressed or uncomfortable, or it might be they're just bored and they just have a party when the owner left and they are destroying things, but they're having fun doing it. They're not actually anxious. We do see that a lot. So I always want to see it.
So how do we know? How do we know if it's
So we
separation
actually
anxiety?
ask our clients to take a brief video for us, like 10 minutes or less. Leave the house and just let's watch. Let's put up a recording and let's just watch your dog with them. If the dog is panicking, obviously we're going to go back. But a lot of the time the dog barks maybe for 30 seconds and then they're sneaking around, they're looking in the trash, they're just kind of like having a blast
so
doing
many
it.
dogs like that. That's so great.
And then we're treating it completely differently than we would if we have a truly panicked dog. So we have to make sure we're treating the right thing before we start treating it.
Different people have different ideas of this, but during COVID, when everybody was home and they got their puppies and they got their dogs and they were there, and then everybody's lives opened up and they went back to work, some people, I wouldn't say all, but some saw changes in their dogs, in the fact that these dogs didn't have any experience of being alone. And so I think from puppyhood, you have to teach your pup that sometimes mom and dad are not going to be there. And that's okay. You can cope. This is your chew time. This is your sleep time. So we really, even from puppyhood, or even if we adopt a dog and get it to we straight off the bat, show them you can be fine and you can cope even when I'm not here.
Yeah, absolutely. Yeah, and Dr. Radasta, so I'm sure you see this a lot in your practice. What happens if those early interventions didn't happen and now we have a really serious problem with separation anxiety? What have you found?
So the first thing we're going to do is attempt, because it's not always clear actually, we're going to attempt to figure out if the dog is actually panicking, if they're frustrated, if they're conflicted, what's going on, right? If we can do that, that's great. If we can't, we can still help. If there's a significant amount of stress, we're going to turn to potentially a departure medicine. Your dog does not have to be on an antidepressant because they have separation related disorders, right? And there's 6 different disorders under the umbrella of separation related disorders. So we're calling it separation anxiety, and that's cool because we can all talk to each other. But we should know there's all these different diagnoses related to people departing, right? So you may get a departure medicine. So if you are gone maybe 3 hours a day and you have a very predictable schedule, your dog's going to get one single departure med. Easy peasy. If your dog has chronic stress, which you guys brought up earlier, then you're probably going to get an antidepressant such as Reconcile, right? Which we talked about earlier. That's the dog branded product of Prozac. And those products take 6 weeks to work. So if your vet gives you, if you go to see Dr. Work and he prescribes Reconcile for your anxious pet, he's probably going to prescribe another medicine too. And that can feel scary. I came in here with 0 meds, and my dog's leaving with 2 meds. So that's where you gotta have the conversation with your veterinarian, right? You have to say, well, what do these meds do? And what are the risks of giving these medicines? Can they be given at the same time? These medicines, do they hurt the liver? Do they hurt the kidneys? Like asking these questions so you feel really confident, because what we don't want you to do is take the medicine home and never give it. Right. And then for your poor dog to get worse and worse and worse. And then we offer 3 behavior modification kind of plans. We don't implement them. We partner with dog training professionals in my community. And so number 1, you can go with a desensitization and counter conditioning schedule. That's going to take 6 months, easy 6 months to get done. And there's pretty high rate of relapse. There's a more kind of classical way where we teach the dog to relax on cue in that ever important sanctuary Zen space, and then slowly expose the dog to departures. And then there's the use of devices like the Treat and Train, which you can get on Sophia Yen's website, that delivers treats while the pet parent is gone. And more pet parents over the past 5 years have opted for that plan because, let's be honest, it's easier and it's okay to press the easy button. Oh my God. So it's easier. We are conditioning the dog to be happy alone. So then we refer out to our dog training professionals, and then we follow up from there.
Again, teamwork is
Yeah.
key.
Absolutely.
Yeah.
Especially
right.
for separation anxiety.
Yeah.
So that's a team effort.
All right, we have the next two questions are similar, so I think we're going to roll them together. One's from Lenny from Oklahoma, and I'm not sure. We'll find out who the other one's from.
Hi, experts. Sometimes my pet seems anxious or down. How can I tell if they're experiencing depression or anxiety? Thanks, experts.
Hi, experts. How can I differentiate between normal nervousness and clinical anxiety in my pet?
In the first video, when he says, sometimes we have this sort of down periods and up periods, I'll circle back again and say, let's get a medical evaluation real quick.
Yeah.
Just again, I want to make sure that your dog doesn't have some sort of chronic pain. There's not something else that's going on. He might be diabetic and we're getting low blood sugar. Like, pets can't talk, they can't tell, so just feel down. I don't know, but that, again, that sort
Especially
of...
if it's a change.
Exactly, it seemed to me like what he was saying was it was kind of cyclical. And I go, let's look at this medically first before we jump into, just behavior.
Yeah, so we can get all technical, right? And we can say anxiety is a concern about something that is not present in front of you. It's worrying.
Yeah.
Depression is apathy. Like Victoria said, it's withdrawal. It's not interacting with your environment the way that you used to do. But now let's just get real. Let's stop calling these behavior problems and behavior issues. Let's call them behavior changes. And what is the difference between a nervousness and pathology or a problem? It doesn't matter. You noticed a behavior change, so it is real. It doesn't have to be some fancy diagnosis. You saw it, it's real. Now you go see Dr. Rourke. Now you say, I have this change in my dog's behavior. And primary care vets are little like mystery solvers. So now they start asking you questions like, what kind of change? Well, sometimes he's depressed. Well, when does that happen? It happens after he eats. He goes in the corner and he goes right behind my couch and he will not come out. And he gets into this weird position, Dr. Rourke, where his front paws are down and his butt's up in the air. And Dr. Rourke's like, your dog's got gut pain. Come on, I know exactly what to do. So you've got to go see your vet when you see a behavior change. And I want to say, I'm sitting here with an amazing vet. Okay. Maybe you go to a vet that doesn't listen to you. I see a behavior change and your vet says, your dog's just anxious. It's time to be real honest and say, look, man, I really want this checked out. I hear you. I respect you. I respect you as a doctor, but I'm not going to sleep at night unless this gets checked out. And if that vet won't check the problem out, you've got to really consider if you're at the right vet.
Well, I love that you said, I don't really, it doesn't matter if it's a clinical diagnosis or not. There's a line that worry turns into anxiety, but I don't know exactly where that line is. I don't think it really matters. If your pet was not worried and now they are worried, does it matter that it's how severe it is? Well, let's go ahead and talk about it and start to implement some training or some environmental changes or some comforting touches that we can do to let's lower that stress level. It doesn't matter that it's gotten to a clinical point. I think a lot of people feel like this is silly to bring this up until it's a medical issue. I go, no, please tell me early and let's make some small changes. And it doesn't matter if it meets some nebulous standard. Let's look at the change and let's address it.
Sometimes you see a low mood. I call it low mood again because I'm not a medical professional, but certainly in dogs that maybe have lost a dog, that they've lost their friend or they've lost a family member, something has changed in the circumstance, and then they withdraw. Then I'm concerned. And I'm going to take my dog first of all to the vet, and then I'm going to start working with the dog to see what now can I do.
Right. Well, let's go to our last question. This one's from Mike in Louisiana.
Hi, experts. Are there natural remedies or special techniques to help calm an anxious pet without medication?
Yeah, we kind of talked a little bit about this earlier, and maybe we can also weave this into the 4th of July holiday for the dogs that are fearful of fireworks. So what are some of those natural therapies or tools?
So I kind of want to just jump into management. Like before, I'm going to let them defer to like the supplements and the natural things more so like what can we do before any of this starts? So we know the fireworks are coming. What can we do ahead of time to be prepared for that versus I feel like so often we wait for the dog to be panicking and then we're trying to fix it. Way harder to do that than if we can be proactive about it. So we're always like, what is the issue and how can we be proactive about it and setting something up beforehand. And I will say, first of all, with the fireworks, making sure that you never let your dog outside off leash, even if you have a fenced yard. If we are anywhere close to the July 4th holiday, your dog should be on leash. We see so many dogs getting lost, hit by cars, tragic things happening right around the 4th of July. So for number one for management is just making sure that they're always on a leash when they're outside.
Excellent.
And I think it's the similar thing to what Lisa was saying. I mean, to create that bathroom, that dog that was going to the bathroom that had thunderstorm phobia, I think the same thing you do for fireworks. You find the dog might gravitate to under the bed or go into a closet. Well, then I'm going to make under the bed or closet that lovely den-like space because that's the dog's safe space.
There are some supplements that have got some good research and data behind them. I would say talk to your veterinarian, see what they like. Some of the ones that are out there, Zilkine, Anxetane, Soliquin, all have good data behind them. They, in my experience, they can sort of take the edge off. It's rare for me to find a pet that's bothered by fireworks, which are loud and aggressive, but a supplement is going to be enough to, you know what I mean, to bring them down. It's such a powerful experience for them. And the other one that I have had success with, and I'll say this non-medication, are some of the compression shirts. The idea being, you know, we know with people, there's a calming effect. Sometimes you see people with weighted blankets. There are compression shirts and things for anxiety, things like that. It's same thing here. So some of those things have some research behind them. They're a starting place. The biggest thing that I beg of pet owners when I talk to someone like this is say, listen, please, do not go into the 4th of July hoping for the best. Please do not. Your veterinarian will be closed. They won't be there. And like the number of people who have a epiphany on the 4th of July at the cookout and go, oh no, fireworks are going to start in 3 hours. And I'm like, the vet's closed. There's no out. The 2nd of July, the 1st of July, that's when you need to have it in your phone, on your calendar as a reminder of go and get some. You can always have support for your pet, like if you want to use medications, things like that. I would rather you have them and we don't need them. Yeah. I would please let us be in that boat and not in the one where you go, I desperately wish that I had said something a couple of days ago.
Yeah, I ask people to contact either my office if they're a patient, right? If their pet is a patient of ours, or their primary care veterinarian 2 weeks before July 4th for a couple of reasons. At least where I live in Florida, it's common to set off fireworks the whole week. I don't know what's happening, but
it's going longer. I don't know why. But
in both directions.
Yes.
It's just crazy. So we need to be well prepared at least a week before 4th of July. Number two, the meds that I use every day are meds that have to be tweaked. You know this because we worked together for a bit. And it's not like I'm going to give a pill and it's going to be, it's magic. My dog is not anxious, but they're not sedated and it wears off immediately when the fireworks are done. That is not how it works, okay? It takes a week for me to even figure out what dose your pet needs. And you have to keep giving it, which means you have to be home, but you work all day, so you can only do it at night, but you can't do it late at night, so you can't do it after you dropped your kid off from soccer. You got to give us time. It's complicated. You got to give us time. But the best thing you can do, to me, is go back to what Victoria's been saying. Your dog has a 50% chance of being afflicted by noise phobia. Fireworks is a part of it. Start as a baby. Teach them, this is your safe space. This is where you go. I drown out the sound here. You always get a food toy here. Isn't this fun? This is so much fun. I really love this. You don't take your dog to fireworks displays. Just don't go. You like to go, it's great, but your dog has a 50% chance. If my pediatrician said your daughter has a 50% chance of getting this thing, if you take her to fireworks, I would never take it. I would never take that bet, right? So don't take that bet. Go ahead and enjoy the fireworks in shifts. You go this year and your partner can go next year, right? Everybody stays home. Somebody stays home with the dog each year. So let's get ahead of the game and be proactive.
And that's one of the reasons why we've always celebrated Pet Anxiety Awareness Month in June, because we want to give you the whole month to prepare, to make your appointment with your veterinarian, to do these things to prepare for the 4th of July. And I'd like to thank our guests for joining us today on this special edition of The Experts, Victoria Stillwell, Dr. Andy York, Dr. Lisa Radasta, and Alex Sessa. Thank you for sharing your insights on pet anxiety, and I've learned a ton, even though I feel like this is a never-ending learning journey about pet anxiety. And thank you for tuning in, and hope you've learned a lot too. And if you'd like to see your question answered on a future episode of The Experts, just record yourself asking that question and send it to dogtv.com/experts. So Alex, we are here at the tail end, get it, of the anxiety special. We had such a great conversation with all the experts. But I thought we should leave our viewers with some tips, some really actionable tips about how to keep our pets calm, especially with the fireworks holiday coming up soon.
Yes.
So what do you have for us?
So I think number one, just managing your dog, thinking about it ahead of time, be prepared, make sure your dog is not going out off leash. Again, making sure even if it's the day before the 4th of July, even if your yard is fenced, your dog has never gone out of the fence before, still just making sure that you have a leash on them, because it just takes one time when they get so freaked out that they just scale the fence and go. We've seen it so many times. So think ahead, plan ahead, talk to your vet about medication. If you think that your dog is a candidate for that, there are short-acting medications that can be slightly sedating, that can help your dog feel better. You want to make sure you administer it before the fireworks start, not waiting until they're already upset. So a lot of it is preventative. There is noise desensitization that can be done ahead of time. If you want to start getting your dog just accustomed to those sounds at a low frequency, building volume as they get comfortable, that is an option. But we do have other options for dogs that are really sound sensitive, and Rosie is bringing me a toy as we do this. But I really love this product, Doggy Hush. So the concept of it is that if we actually physically cover the dog's ears, it can help muffle the sounds to some extent.
They're like noise canceling headphones for your dog.
Exactly. So not right for every dog. If a dog is really body sensitive, it doesn't like something in their head, it might not work for them, or it might just take some time to acclimate them to this product. But if we can just muffle the sound, sometimes that's all it takes for some dogs, is to just lower the intensity of the noise. So this is a great product for dogs that just don't do well at a high volume of sound. They just maybe need that sound muffled a little bit.
Yeah, and Doggy Hush, which is being used worldwide, is great for all sorts of noise phobias, socialization issues, and more. It's not just for fireworks.
And then how about creating a safe, quiet space for our pets?
Yes, that is always a great place. If we have a dark, quiet space, ideally with no windows, maybe that's really well insulated so that the noise isn't quite as powerful. So a bathroom, a laundry room, somewhere that the dog can go that has their favorite things, toys, a bed. We love to put on white noise or calming music.
You can also put on DOGTV.
That's right. DOGTV, white noise, something to help drown out those sounds outside can be really helpful.
And let's talk about crates, because PetMate is one of our partners, and they've sent these crates. They're versatile. You can use them for travel. You can use them at home. But how can a crate help our pets stay calm?
So it's just a safe and consistent place for our dogs to go. Some dogs really love to have a confined space that they can go to, especially if you leave the door open. So we're not saying you have to stay in there. We're saying it's an option for you when you're uncomfortable. So if you put, I love that we've got beds in here that perfectly fit the space, so they could just hop right in there. And if they're uncomfortable, they can leave, but they know that they have that consistent space to go back to. Some dogs really prefer this style of crate where it's a little bit more closed in. Some really prefer the openness of this crate. And sometimes even just putting a blanket, a towel over can be helpful too. A lot of times we like to leave at least one side open so it's not fully enclosed, but sometimes just a little bit of extra coverage can be helpful.
And how important is it to exercise our pets prior to a noise event so that they're a little bit more tired?
You can't necessarily out-exercise panic or anxiety. If you think about like a really stressful event happening, it doesn't matter how tired you are. You're still going to be stressed out or panicked, but it can't hurt. So we want to make sure that our dogs aren't coming to the day really amped up and already just needing exercise. So it cannot hurt to get a good long walk in before any of those fireworks start, before the storm starts, just trying to get a little bit of that extra energy out.
Okay, Alex, let me tell you a little bit more about Nationwide. What I've always found so beneficial for pet insurance is it allows me to focus on the care of my pet, not the cost. And during the show, we talked a lot about, make sure you take your pet to the vet if you suspect that they have noise anxiety or separation anxiety. So the most important thing with pet insurance is you have to do your own research. Find out what's covered, what's not covered, what it's going to cost, and what the claims process is like. Alex Sessa from Peach Unleashed, thank you so much for being here, and we'll see you next time.